Dr. Hanson with Hanson Chiropractic and Injury, and today I'm going to be taking care of my partner, Dr. Wynn. We take care of all of the doctors here and practice what we preach. So Dr. Wynn does a lot of work over the table, working with patients, working with the computer. So from his posture, you can see he tends to have what we call forward head posture, which is where the head is carried forward in front of the shoulders, which puts strain on the cervical curve and creates compression at the base of the skull and at the base of the neck. So very common in like text neck and computer neck type issues. So we're going to be doing some adjustments to reduce that postural shift. So he has a lot of muscle activity at the base of the skull, the suboccipitals, on the left side, and fixation where the cervical curve meets the thoracic curve, what's called the cervical thoracic junction. And then at this junction, which is the transition between the mid-back and the low back, he's fixated there, meaning the joints do not spring, do not move the way that they're supposed to. The number one cause of pain in the spinal region generally is a loss of mobility of the joint, causing strain to the facet, which sets off the pain receptors. And we're going to adjust to unlock his L5 right at the base of the back and the sacrum. And we'll go on your other side here. Good. Easy. There we go. So now I'm putting him in the mirror image or the opposite posture that he carries himself. So instead of his pelvis being forward, rib cage back, head forward, we've reversed that posture. Pelvis is back, rib cage is forward, head is back. So the analogy is it's like if I had to unbend a hanger that was overbent in one direction, I would overbend it the other direction to be able to come out straight. So we're going to be adjusting through this section of the spine. So right at L3, L2, L1, and we're going to work at T12, right at that thoracolumbar junction right now. Good. Let your shoulders just relax there. And we're going to work on releasing this area. Good. And right here, that's it. Good. And now I'm going to work on bringing that section of the spine forward and reducing that forward head posture. Good. This is the most important section of the spine. As the head goes forward, again, very common if you're working at a desk or a computer, texting, looking down, prolonged driving, tends to push the head in this forward posture. The eyes have to come up on the horizon. So as the chin and the eyes come up, it creates compression right at the base of the skull. That's very common for headaches, neck pain, tension across the neck and shoulders, chronic stiffness in the neck. It can affect your balance, dizziness, vertigo type symptoms also. So we're going to make sure his occiput is moving well and it's not locked up. So I'm going to need to lift right here in the upper part of the neck. It's a little tender there. Now, okay. And so I'm going to use this instrument called a lopes. And this helps to unlock that joint and work on some of the musculature at the base of the skull and open up that suboccipital area. Take a deep breath in and go ahead and tuck your chin. And we just put a little pressure there. And take a deep breath in. And and then all the way out. And again, very effective for neck pain, headaches, and chronic stiffness, soreness in the neck. You've got to unlock that occipital area. There's a lot of different techniques to be able to do that. So boy, we look at his posture and you can see a dramatic difference. So his head's much further back over his shoulders. His chin is more tucked, he's more upright, chest is up and out. So we went from this forward head posture, rib cage rolled back, to head being pulled back, rib cage pulled forward, pelvis in line. So now he's nice in a nice stacked sagittal or side view posture. So excellent, very, very good. So from here, normally what we do is we'd also be doing traction and exercises to reinforce what we've done as far as the adjusting. That's how you get long-term changes. So if you would like more information, always feel free to give us a call at Hanson Chiropractic and Injury. We are here to serve you, and we look forward to taking care of you in the future.